Is looking at the statistics of cervical cancer in Jamaica, the death rate and the infection rate, and presenting that information to the Ministry of Health to see if
an abnormal pap smear and it follows the guideline where you need a colposcopy, meaning that it's HPV positive. It could be ascus, it could be low grade changes in the squamous cells, depending on whatever, any one of those that I just mentioned. It's you may have to do a colposcopy. A colposcopy is just basically doing the same process like a pap smear. It starts that way, but I have a scope that I look in and I look at your cervix and I try to see if I can see any area that I need to take a biopsy to send to the lab to see if it is indeed, cancer cell, precancerous cells. And it's just a tiny pinch. Just take some Motrin before you go. That probably help, to decrease the pain. But it's usually maybe 2 or 3 little pinches that they take off, very, very small. And we put it in different containers where we label what part of the cervix we take it from. And then we send it to the lab. The lab go ahead and they look at it and they send us back a results. And they say, well, either they say, yes, this is precancerous cell, or no. If it is precancerous cells, depending on the stage, we may send for another procedure called a LEAP, which is, where they take care of that area of the cervix, so to prevent it from going any further. So, but the colposcopy is kind of like the second stage after the pap smear. You do the colposcopy, and majority of the time the colposcopy come back negative. So don't be afraid to get it done. It's better to know than not to know. If they tell you need to get it, go ahead and go and get it, because that could save your life. Right. But with the scope, I am looking, it magnifies the cervix and I can see the cells closer. So there are different cells that I'll be looking for to see if they are these normal cells. What are the different types of cells that are normal on the cervix? If I don't see the normal cells, or I see areas, white patches or something like that, I'll take a sample. I'm trying to not get too complicated and that people can understand. So I'll just take a sample of the areas that I see that doesn't necessarily look like a healthy cervix and send it off to the lab.
Is there any liquid or any painting or any dyes that you
put on the cervix? You do. Most of us use vinegar, because when you put the vinegar on the cervix, if there's abnormal cells there, it shows up.
Okay.
Makes it clearer, yeah.
And then you take the sample from that area that looks abnormal.
Abnormal, yeah.
So if you go in and everything looks normal, do you still take that little biopsy, or you just let it stay?
Sometimes depending on what the pap smear says, sometimes you don't take. Sometimes, and if the patient is pregnant, that's also a consideration as well, because you don't want to disrupt the cervix if the patient is pregnant. You want to wait until after you get it done. So if it's not something like, if it says high-grade lesions, yes, you do want to do that. I had a patient a couple of weeks ago that it said she had high-grade lesions. I went in and I did the colposcopy. When I looked at the cervix, I knew immediately that something did not look right. It was normal. And I took 2 little samples because I knew I had to do it at this point, because the cervix just did not look like it's supposed to look in her situation. And of course, she had cancer.
You'd also talk about the LEAP. So you did your colposcopy and you realize that there's a lesion there.
It does. During the procedure, they do remove the part that is cancerous.
Right.
I don't do that because as a nurse practitioner, that is not in my scope, but I send it to the GYN, the surgeon, and they go from there.
Okay. So the colposcopy, is this an expensive test? Is it something that, say for instance, I have an abnormal pap smear, but a colposcopy wasn't recommended. What if I want it? Can I just say I still want it and I go pay for that?
You have to pay for it. The insurance company is not going to pay for it. So different offices charge different prices, but it's a couple of $100s to get it done. I would say at least $300-400. That's on the lower end. It depends on the office.
Okay.
But it is a costly exam.
Okay, so this brings me to your role that you play in detecting, screening for cervical cancer getting the colposcopy done, you have a office that you're starting up in Jamaica, and you're going to be offering this service there. So tell us about that.
Montego Bay, it's half Orange Street. And like I mentioned earlier, my aunt passed away from cervical cancer, and I feel like it shouldn't happen. A lot of people in places like Jamaica are, dying early or going through serious complication from things like these that are very preventable. So my office is that I would like to provide these services, especially the colposcopy if they have a positive pap smear and abnormal pap smear. And important to me. I just feel like that we shouldn't be in this time be having these issues. And a lot of time is because one, people are not educated on what HPV is, what pap smears are for, and how it can save your life. And I also want to be able to provide a lot of education to the women of Jamaica, especially the young girls. I want to advocate for them to get the vaccine to help prevent HPV infection turning into cervical cancer. I just want to spread awareness on what cervical cancer is, how do you take care of yourself, how do you get screening, and I want them to have a place that they can come to and know that there will be a safe haven, a continuous place to follow up.
So in the terms of Jamaica, the health system is a little bit different. It's structured a little bit different. And I know that you said in some cases you would like to offer it, free. In terms of getting these specimen tested, there's a cost to that, and somebody has to pay that cost. And if it's going to go into the public sector part of the health, never get that result back within a year or so. So you're pretty much going to have to be using private labs to get these.
Yes, I will be probably using private labs, but there's things that I will be working out with people because I'm trying to make a part of this as a nonprofit. So I'll be working out how to get some of these screening done for free, and more people out there, Cheryl, that want to help than you could even imagine. Yes. It's not always about the money. I mean, I am putting up my own money to do this in Jamaica. I did get a lot of donations from a doctor that's closing her practice here. I got I can't even tell you how blessed I am. And because of that, I know that I'll be able to get some of the labs to donate some of their services. I also want to do health fairs. So I have a lot of physicians who are willing to come down. I'm not sure how, maybe once a year I'll be doing this. I haven't gotten to that part yet, but they're willing to come down and help me to take care of these patients. So those are some of the things that I'll be working on. And I already have in contact with some labs. We just have to work out the logistics, but I'm pretty sure that everything is going to be okay and we're going to be able to offer some of these services for free. That's my goal, and I know it's going to happen.
And also a recommendation is looking at the statistics of cervical cancer in Jamaica, the death rate and the infection rate, and presenting that information to the Minister of Health to see if they
can assist,
donate some funds to a nonprofit organization, and to see if they can help in that area to have women in that part of the island get screening. And even not just that part of the island, people can leave from Kingston as well, because the distance is now shorter because of
with the highways and everything, it is shorter.
Maybe 2-3 hours and you're in Montego Bay. They do it all the time to go to party.
So they can do it to get their pap smear done. Absolutely. I agree with you.
Exactly. It's not like, it's a part of the island that's not accessible to them. Mm-hmm. It is. I wish you all the best with this venture. I think it's a very, very good thing. And it's for a purpose, for a cause. And I really want you to reach out to the women who really need it. Everyone need this, everybody need this screening. What age should a woman start screening for?
Age 21. And we'll stick with that because usually a lot of people aren't having sex before that. And even if they do, sometimes the HPV virus goes away on its own when they're younger. But as soon as they get to 21 and older, that's when the recommended age is to start the screening. So I'll stick to those guidelines. you know, and like I said, because it can be costly, I'll try to minimize the cost. However, try to make sure that everybody, you know, everybody get a chance, a fair chance to get access to the care. Now, like I said, education is very important. And I think I'm going to be focusing a lot on educating the young girls as to what pap smears are, because a lot of them have never heard the term pap smear before. They don't know what it is. They don't know where you get it from, what happened. They have no idea what it is. They don't know what HPV is, you know. So I want to do a lot of education. And I think by doing a lot of education, you get the word out and people are more aware of the causes and how this can affect them moving forward.
Is there an age when you stop screening?
They say 65, but if it's an active 65 years old, I'm going to still screen.
Okay, great.
Because some woman at 65, they're still having fun.
Okay. How can anybody reach you if they need to donate to your cause or help?
I will be putting up all that information soon. I don't have all that information together at the moment because we're not open yet, but I will be putting out those information on my page as soon as it comes available.
In terms of if they want to reach out to you before it's open, what if they want to help you with the whole process? Is there a way to contact you? There's an email that I can pin in this video?
Absolutely. It's Nfong Edwards, N as in Nancy, Fong, Edwards with an S, @gmail.com.
Okay, great. Thank you so much, Nancy, and good luck. This is Dr. Morgan with L Talk. Have a great day. Bye-bye.
Thank you, Dr. Morgan, for having me.
You're welcome.
Bye.